So this is what we do with a combination of deep tissue laser therapy and Rocktape for a triathlete or a runner. There are certain key points that we want to prime prior to taping and prior to the athletic event. I'm going to show you three very powerful ones here. So I will always do the bottom of the foot with laser first, because this is a high traffic area of impact, but you also have a lot of connective tissue here via your plantar fascia, and that's going to make it much more elastic for them when they run, so they'll feel a difference in their speed and their performance. And I'm going to do about 1,000 joules to 1,500 joules here, and we laser first because we want to prime that tissue, get blood circulation going in there, release up that fascia. Now we're going to move into the deep part of the calf. For that one, I'm going to put a little bit more pressure. You get into a position where you can apply the roller right in here, and I'm going to hand and put pressure coming up underneath and the deep structures of the calf that typically get a lot of tightness and a lot of tenderness with runners. The prime area that we want to cover here is the thoracolumbar fascia, and this is very important for runners or triathletes because that's going to be the bridge between the arm and the hip on the opposite side. So this is going to unleash a lot of power, and this is a place where there's a lot of sticking or adhesion to the fascia, and the laser works fantastic here. So then you're going to actually place the laser here with the ball and work up and down that fascia close to the spine, then off to the side. And don't be afraid to put some pressure in here. The calf is a high stress area, so we're going to tape that first. And we always want to stretch the tissue that we're going to tape first. So we elongate it, so she's going to dorsiflex here. I'm going to take the tape, apply my anchor point right down here on the Achilles tendon, and then on the calf I like to put what's called a decompression strip, which is right across the attachment point of the gastroc into the soleus, because it's a high impact area, and also as it ties into the posterior tibialis. So then we take a decompression strip, we tear it down the middle, and we're going to separate the center. I'm going to put about a 50% stretch on this, and we do that by stretching 100%, and then we're going to back it off halfway. Place it right in that spot where the soleus is. Rub the center part down, and then you don't stretch the ends of the tape, you just lay them down. All right, so the next area we're going to tape is the hamstring. You want to pre-measure your strip, okay? And we're going to stretch the tissue, not the tape. So we're having her stand up to stretch the hamstring. We're going to tear a piece away and put our anchor point down, coming right up a little bit into the glute max and the sacrotuberous ligament. Now with this one you don't have to, but if you want to put a decompression strip here as well, you certainly can, and I would do that right over the center piece of the hamstring. An area that I always tape on every single athlete, no matter what your event, but particularly in a runner and triathlete, is the thoracolumbar fascia that we lasered before. It's such a bridge of power between the upper body and the lower body. And then this time we're going to use our what's called the Big Daddy tape. It's 4 inches wide, and then that one is going to be a decompression strip right here in the center, and you're going to want that to be right here where the rib cage ends, so right around T12 and L1. So you're going to be able to wrap around the thoracolumbar fascia, part of the oblique structures here as well, and the quadratus lumborum. And we're going to put about a 50% stretch on this, so I'm going to go to 100 again, and then I'm going to back off halfway. I'm going to place that right there in the center. It can have the most powerful impact on your body to do laser here and tape here. Then don't stretch the ends, lay down the tape. Rub to activate the glue. And now you've lifted up and helped that recoil system from here to here. Automatically a change in power and gait.